Have you ever wondered how your arm is able to perform such amazing feats of strength and dexterity? It's all thanks to a fascinating network of nerves called the brachial plexus. The brachial plexus is at the root of the neck. This intricate system is formed by the convergence of nerves from the 5th, 6th, 7th, and 8th cervical, as well as the 1st thoracic spinal nerves. These nerves come together like a team of superheroes, working in perfect harmony to provide the nerve supply for your upper limb. Another analogy for the brachial plexus could be a bridge or highway system that serves as a crucial pathway for nerve signals to travel from the spinal cord to the structures of the upper limb. The nerve signals can be likened to cars, which rely on this pathway to reach their destination in the upper limb. Like a highway system, the brachial plexus has branches that extend throughout the upper limb, reaching all the way to the fingertips. Any disturbance or injury to this pathway can significantly affect the arm's proper functioning. But fear not, because anatomists have meticulously studied and mapped out the brachial plexus, providing us with a simplified diagram that clearly shows the structure and division of this amazing network of nerves. The brachial plexus can be distinguished into 5 parts. Here in this simplified illustration, you can see them. Here are the roots of the brachial plexus. Next up, we have the trunks. Then the divisions. Next up are the cords. And finally the branches. The roots or the rami come together to form trunks and so on. We will go through them one by one. But before that, you should know. As the brachial plexus emerges from the neck region and in the region of the axilla, it is closely related to the clavicular bone. Thus, the parts of the brachial plexus are also identified as. Roots and trunks are also known as the supraclavicular part, located above the clavicle. Divisions, also called retroclavicular part, are situated or located behind the clavicle. Cords and branches, also called the infraclavicular part, are situated or occurring below the clavicle. As I mentioned before, the nerves that will eventually supply the upper limb come together like a team of superheroes, each one bringing its unique powers to the table. The 5th and 6th cervical nerves join forces to form the upper trunk, while the 7th cervical nerve carries on as the middle trunk. Meanwhile, the 8th cervical and 1st thoracic nerves team up to form the lower trunk. It's a true collaboration, with each nerve bringing its own strengths to the table. But that's just the beginning. Each trunk then divides into anterior and posterior divisions, like branches on a tree. The anterior divisions of the upper and middle trunks come together to form the lateral cord, whereas the anterior division of the lower trunk continues as the middle cord. Meanwhile, the posterior divisions of all 3 trunks unite to form the posterior cord. It's like a complex web of nerves, each one connecting and interacting with the others to create a truly intricate network. And that's not all. These cords continue, giving off the main branches of the brachial plexus. These branches are the lifeblood of your arm, carrying vital signals to every part of this amazing limb. The brachial plexus is a complex interwoven system of nerves that play a crucial role in powering our arms, hands, and fingers. Simply labeling the nerves is not sufficient to fully comprehend the intricate network of nerves that controls movement and sensation in our upper limbs. We will now label and create mnemonics for the different branches of the brachial plexus to aid in memorization, starting at the roots and upper trunk of the brachial plexus. The roots of C5 and C6 give rise to 2 crucial nerves, the dorsal scapular nerve and the long thoracic nerve. These nerves may be small, but they play a big role in connecting the brachial plexus to the muscles of the back and shoulder blade, allowing for a greater range of motion and flexibility. The roots of C5 and C6 give rise to the dorsal scapular nerve, which supplies the rhomboid major and minor muscles. These muscles are important for stabilizing the shoulder blade and for movements like pulling the shoulder blades together. The same roots also give rise to the long thoracic nerve, which supplies the serratus anterior muscle. This muscle helps to rotate the scapula and lift the arm, making it crucial for a variety of movements, such as throwing a ball or doing a push-up. So, these two nerves are the only ones that originate from the roots of C5 and C6. Moving up to the upper trunk, we find the nerve to the subclavius, which supplies the subclavius muscle. This muscle helps to stabilize the clavicle during movements of the arm and shoulder. The suprascapular nerve also arises from the upper trunk and supplies the supraspinatus and infraspinatus muscles. These muscles are important for rotating the shoulder and for movements like lifting the arm out to the side. These two nerves are like the dynamic duo of the brachial plexus, providing strength and precision to our shoulder movements. Together, these four nerves and the muscles they supply play a crucial role in our daily movements, allowing us to perform complex activities with ease and precision. Now let's move on to the branches that arise from the cords of the brachial plexus. From the three cords of the brachial plexus, several nerves branch off. We will look at them one by one and memorize them with the help of mnemonics. Starting with the lateral cord, we have three important nerves that arise from it. The first is the lateral pectoral nerve, which supplies the pectoralis major muscle. This muscle is responsible for adducting and flexing the arm, making it crucial for movements like pushing and lifting. The musculocutaneous nerve also arises from the lateral cord and supplies the biceps brachii muscle, which helps to flex the elbow and supinate the forearm. It also supplies the brachialis muscle, which is important for elbow flexion. Lastly, the lateral root of the median nerve arises from the lateral cord and supplies several muscles, including the pronator teres, flexor carpi radialis, and palmaris longus muscles. These muscles are important for wrist and finger movements and for rotating the forearm. The mnemonic that we can use here is lucimet liam, where the L is for lateral pectoral nerve, M is for musculocutaneous nerve, and L and N is for the lateral root of the median nerve. These are the branches of the brachial plexus that originate from the lateral cord. Next up, let's look at the median cord of the brachial plexus. We have four important nerves that arise from it. The first is the median pectoral nerve, which supplies both the pectoralis major and pectoralis minor muscles. These muscle is important for stabilizing the shoulder blade and for movements like pulling the shoulders down. The medial cutaneous nerve of the arm and forearm also arises from the median cord and supplies sensory fibers to the skin of the arm and forearm. The ulnar nerve, which supplies several muscles of the forearm and hand, also arises from this cord. Finally, the median root of the median nerve arises from the median cord and supplies several muscles, including the flexor pollicis longus and pronator quadratus muscles. The mnemonic for the branches of nerves that arise from it is my mum. The capitalized letters are assigned to these nerves. Median pectoral nerve, medial cutaneous nerve of arm and forearm, ulnar nerve, and median root of the medial nerve. Lastly, we have the branches of the posterior cord, which can be remembered using the mnemonic star. The subscapular nerves, both upper and lower, supply the subscapularis and teres major muscles, which are important for internal rotation and adduction of the arm. The thoracodorsal nerve supplies the latissimus dorsi muscle, which is important for pulling the arm down and back. The axillary nerve supplies the deltoid and teres minor muscles, which are important for shoulder movements. And the radial nerve supplies several muscles of the arm and forearm, including the triceps brachii, brachioradialis, and extensor carpi radialis muscles. As you have seen, the intricate network of the brachial plexus consists of numerous branches that are extensively distributed throughout the upper body. These branches extend outwards and provide motor and sensory innervation to the muscles and skin of the upper limb. Why don't you take a minute and test your knowledge of what we have learned so far? Let's set a timer for 40 seconds and see how many branch names you can remember based on the mnemonics provided. Time's up. Here are the names of the branches. Good job if you remembered all these branches. Even if you were unable to do so, don't be disheartened. You can rewind the lecture and go through the branches of the brachial plexus again. Or you can also download this lecture in PDF form and go through the notes quickly. Now that we have gone through the anatomy of the brachial plexus, you have an idea of how important this structure is, as it provides motor and sensory innervation to the upper limb. The proper functioning of the brachial plexus is critical for normal upper limb function, including movement, sensation, and strength. Unfortunately, brachial plexus injuries are not uncommon and can have a significant impact on a patient's quality of life. The patient often complains of pain, weakness, numbness, and in severe cases, loss of function in the upper limb. These injuries can occur due to various reasons. There are several common causes of brachial plexus injuries, including birth trauma, motor vehicle accidents, and sports-related injuries. Newborns can sustain brachial plexus injuries. These may be associated with high birth weight, breech presentation, or prolonged labor. If an infant's shoulders get wedged within the birth canal, such as in the case of shoulder dystocia, there is an increased risk of a brachial plexus palsy. Most often, the upper nerves are injured, a condition called Erb's palsy. Klumpke's palsy, on the other hand, affects the lower brachial plexus and is much less common. Erb's palsy is the more common of the two and affects the upper brachial plexus. It usually occurs when there is excessive stretching or tearing of the nerve roots between the 5th and 6th cervical vertebrae. The result is a weakness or paralysis of the arm, with the affected limb often held against the body and the hand turned inward. In some cases, the condition can be temporary and resolved on its own, but in severe cases, surgery may be required to repair the damaged nerves. Klumpke's palsy, on the other hand, affects the lower brachial plexus and is much less common. It occurs when there is damage to the nerve roots between the 7th cervical and 1st thoracic vertebrae. Symptoms include weakness or paralysis of the hand and fingers, with the wrist and fingers curling inward. In some cases, the condition can be treated with physical therapy and surgery, but the prognosis can vary depending on the severity of the injury. Both Erb's palsy and Klumpke's palsy can have a significant impact on a child's quality of life, affecting their ability to perform daily tasks and participate in sports or other activities. It is important for parents and healthcare providers to be aware of the signs and symptoms of these conditions and seek prompt treatment to minimize the long-term effects. The second common cause of brachial plexus injury is motor vehicle accidents. It can result in various types of injuries, including brachial plexus injuries. The impact of the accident can result in the brachial plexus being stretched, compressed, or torn, leading to damage to the nerves and muscles in the upper limb. The severity of the injury can range from mild to severe, depending on the type of injury and the force of impact. Car accidents can cause brachial plexus injuries due to the quick shock or impact of the collision, example, whiplash injuries. When the head and neck are violently yanked back and forth, as can happen in a car accident or during sports, whiplash leads to nerve injuries. Symptoms of brachial plexus injuries can include neck pain, weakness, numbness, or tingling in the arm or hand. In severe cases, a person may experience complete paralysis of the affected arm. Sports involving contact, like football, rugby, and wrestling, are the third factor in brachial plexus injuries. These injuries are commonly referred to as burners or stingers and are caused by sudden movements or collisions that stretch the nerves beyond their limit. Repeated episodes of burners or stingers may lead to more serious injuries, such as nerve root avulsions or brachial plexus palsy. In football, players may experience burners or stingers when their head is forcefully pushed to one side while their shoulder is pushed down, causing the nerves in the brachial plexus to stretch. Symptoms of burners or stingers include a burning or stinging sensation that travels down the arm, weakness or numbness in the arm or hand, and difficulty moving the affected limb.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.